Hello my dear friends. Today I am going to discuss about PSA and screening PSA. This is very important topic for the public. As I have seen the awareness etc. about the public, this is very confusing part in the mind of the general public, because they think that if a patient has high PSA, then this patient has a prostate cancer. This is not the truth. PSA is a prostate-specific enzyme and it is secreted by the normal prostate cells. So, if PSA is very high or increasing fast, so there can be some benign causes also rather than always the prostate cancer, and these may be infection. It is one of the most common cause of rise in PSA. That means the patient should not get scared if his PSA is high. Now, how the screening is done? As such, there is no specific cutoff where we can see that okay, now your PSA is beyond this, so you should go for the prostate cancer treatment. No. The PSA just gives us a clue that who are the high risk patients for developing prostate cancer, and these are the actual patients. Basically, they should be evaluated to rule out the prostate cancer. If you start evaluating all those patients without deciding the risk factors, there will be enormous burden on the economy because it is not going to be cost effective. So, if a patient has less than 4 nanogram, it has been seen that majority of the patient the possibility of prostate cancer is significantly very low. So that is the reason these patients are left as such. But that doesn't mean these patients are totally safe. They can also have prostate cancer. Similarly, all those patients who have more than 4 nanogram per ml of level, they have little bit higher possibility of prostate cancer, and this possibility keeps on increasing depending on the how fast the PSA level is increasing. Until unless the PSA level is very high, say 100, 200 or beyond this, one should never label a patient prostate cancer without doing a tissue diagnosis. That means without doing any biopsy. So, coming again to the PSA screening. The PSA screening is done for those patients who have higher possibility of getting the prostate cancer. And in this, the first thing comes as the age. The possibility of enlargement of prostate as well as prostate cancer increases according to age. This is a disease of elderly. But there are some patients who have familial history of prostate cancer. So they are the patients who are little bit higher risk. So these patients should be kept on PSA screening after 40 years, and this PSA screening should be on the annual basis. If the patient has no previous familial history, so these patients should be screened on annual basis but after the 50 years. The another category is those patients who are more than 60. They should be kept on the screening PSA after 60 without any risk. Okay, that means after 60, majority of the patients, especially those who have high PSA, are at risk for the prostate cancer. So, what is the normal level of prostate cancer? There is nothing like this. Okay, patient with 2 nanogram per ml patient can have prostate cancer, very bad prostate cancer. Patient with 10 nanogram per ml may not have prostate cancer. So, depending on the assessment of the PSA, there are some other risk factors. They are also kept in mind, and by calculating the final risk of developing the prostate cancer, the patients are segregated. So, if the PSA level is more than 4 nanogram per ml and the size of PSA is small, That means there is some relative increase. The possibility of PSA level goes beyond a particular assumption. That means if I think I come across a small prostate, that means they have lower number of prostate cells, so there will be low PSA level. Okay, but there are patients who have very bad or very undifferentiated kind of prostate cancer cells with low PSA, because the PSA is synthesized by the mature prostate cells. Okay, and the rapidly progressing cancer cells, they actually divide so fast that they don't get time to get mature. Okay, so all those patients who have less than 4 nanogram, they are also possibility of prostate cancer, and more than 4 nanogram, they have possibility. So depending on the possibility, this screening is done. Now depending on the screening, a risk assessment is done, and after assessing this risk assessment, the possibility of next evaluation, that is most of cases it's the prostate biopsy, is decided. I'm not going to discuss anything about the guidance of biopsy etc., because that is going to unnecessarily confuse the viewers. So this is all about the PSA and screening of the PSA for laymen, for the public purpose. Okay, thank you so much.